My name is Megan Michael, and I am a neuroanesthesiologist at UT Southwestern in Dallas. I am the spring awardee of 2023 of the APSF FAIR MRTG grant, and I am studying perioperative teamwork and structured communication. All right, there we go, slide advance. We all know that team communication in the operating rooms is critical. In fact, the Joint Commission has identified miscommunication as the #1 cause of sentinel events. So my study is going to take a program called IPASS that has been very successful in decreasing medical errors outside the OR and adapt it to the OR space using some evidence-based methods. The team that I'm collaborating with includes Dr. Chris Landrigan at Harvard, who is the original PI for IPASS, UT Southwestern's Team First program, which is a longitudinal team training program, and Wake Forest Wake Wings program, which is a sort of team competencies and psychological safety, culture of safety program that they have at Wake Forest. We'll look at all perioperative areas, not just the OR. And what we started by doing was a needs analysis. We adapted some of the questions from IPASS's needs analysis surveys, added some of our own, sent them out. Once we got the surveys, we went ahead and did some focus groups and some interviews. Then we used that needs analysis, to incorporate IPASS principles, Wake Wings principles, and Team First principles and create an intervention. We actually were able to roll this out on September 4th of this year. Our primary outcome is error rates, both pre and post. We're going to assess these using IPASS's validated methods that they've published before. Secondary outcomes will include team competencies like psychological safety, teamwork behaviors, and providers' assessments of the intervention. Balancing measures will be OR turnover times and handoff duration. We actually have a 5-part intervention that includes a 20-minute interactive module, an in-person 1-hour multidisciplinary training session. Then we're going to have some written documents that incorporate some IPASS structure that are going to help convey some of the most salient points about patients, make sure those aren't missed. We have cognitive aids to help structure our handoffs. And finally, we're going to have some refreshers with updates and Safety 2 innovations. You can see our timeline here. Right now, we have just passed the rollout on September 4th, and we are waiting to start our post-intervention data collection in early mid-November. We will also send out a survey at that time on provider acceptability. And then finally, once we have collected all of our post-intervention data, we will analyze and publish a manuscript in the spring. Thank you so much for listening. Have a good day.